Anaphylaxis. Anaphylaxis is a severe and potentially life-threatening allergic reaction that can occur rapidly after exposure to an allergen. It involves a systemic release of chemicals such as histamine, leading to a widespread inflammatory response throughout the body. This reaction can affect multiple organ systems and, if not promptly treated, can be fatal. What causes anaphylaxis? Anaphylaxis is triggered by exposure to an allergen, which is a substance that the immune system identifies as harmful, even though it may be harmless to most people. Common allergens include 1. Food allergens. Foods such as peanuts, tree nuts, sesame, shellfish, fish, milk, eggs, and soy are common food allergens. 2. Insect stings, such as bee and wasp stings, as well as ant bites, can cause anaphylaxis in susceptible individuals. 3. Medications. Certain drugs such as antibiotics, e.g. penicillin, non-steroidal anti-inflammatory drugs, NSAIDs, and others, can trigger severe allergic reactions. 4. Latex exposure. Some people may develop anaphylaxis in response to latex exposure. Symptoms. Anaphylaxis symptoms can vary but often include 1. Skin reactions, hives, itching, and flushed or pale skin. 2. Respiratory symptoms, shortness of breath, wheezing, coughing, and chest tightness. 3. Gastrointestinal symptoms, nausea, vomiting, abdominal pain, and diarrhea. 4. Cardiovascular symptoms, rapid or weak pulse, a drop in blood pressure, and dizziness. 5. Other symptoms, swelling of the face, throat, or tongue, a sense of impending doom, confusion, and loss of consciousness. Treatment. Immediate treatment is crucial for anaphylaxis. Key steps include 1. Epinephrine. The first-line treatment for anaphylaxis is epinephrine, adrenaline. It rapidly reverses the symptoms by constricting blood vessels, relaxing airway muscles, and inhibiting the release of inflammatory chemicals. 2. Call for emergency assistance. Even if epinephrine is administered, emergency medical assistance should be sought immediately. 3. Antihistamines and corticosteroids. These may be used to help control symptoms and prevent a delayed reaction. 4. Oxygen and intravenous fluids. In severe cases, supplemental oxygen and intravenous fluids may be administered to support cardiovascular and respiratory function. Risks of anaphylaxis. Anaphylaxis is a medical emergency that can be life-threatening if not treated promptly and effectively. Without intervention, anaphylaxis can lead to respiratory failure, cardiovascular collapse, coma, and death. Common risks associated with anaphylaxis are rapid onset. Anaphylaxis can progress rapidly and delayed treatment increases the risk of severe outcomes. Respiratory complications. Severe respiratory symptoms can lead to a respiratory failure. Cardiovascular collapse. A rapid drop in blood pressure can result in cardiovascular collapse and shock. Fatality. Without prompt and appropriate treatment, anaphylaxis can be fatal. How to prevent anaphylaxis? Preventing anaphylaxis involves identifying and avoiding triggers whenever possible. Individuals with known allergies should know and avoid known allergens. If at risk, undergo allergy testing to identify specific triggers. Carry an epinephrine auto-injector at all times. Read food labels carefully and ask about ingredients when dining out. Avoid known allergens and take precautions to prevent insect stings. Emergency action plan. Those at risk should have an anaphylaxis action plan, including the use of an epinephrine auto-injector. Please note that anaphylaxis is a severe allergic reaction that requires immediate medical attention. Prompt administration of epinephrine and emergency medical care are critical in managing anaphylaxis and preventing complications. Individuals with known allergies should work closely with healthcare providers to develop a comprehensive management plan and learn how to recognize and respond to symptoms of anaphylaxis. In our channel, you'll find extremely useful videos about various diseases, cancer-related diseases, vitamins, minerals, and much more, so don't miss them. Thank you for watching.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.